Welcome back to TV5 News at 9. Today we are talking about minimally invasive spine surgery with Jag and Nathan Neurosurgery. Joining us this morning is board-certified neurosurgeon Dr. Adam Kramer. Thank you so much, doctor, for being here.
Thank you.
You are welcome. Okay, so first, tell us a little bit about what is minimally invasive spine surgery?
So, from a patient perspective, minimally invasive spine surgery means a smaller incision, and as you might imagine, through a smaller cut, less tissue is disrupted and mobilized. Therefore, there's less pain and a much faster recovery. So instead of having a long stay in a hospital or nursing home, patients are able to restore activity much faster.
That's great. So what types of procedures do you do using this type of technique?
So all of the common procedures I'm able to do through this type of approach, where I use a small tube, a tube that's smaller than your index finger, which means the incision is less than an inch. So I can do all the common pathologies for back surgery and neck surgery this way. And, you know, from my perspective, it's incomparable, right? Minimally invasive spine surgery allows me to do a much more precise surgery. I'm able to target the root cause of a patient's pain. So with the tube and the microscope, I'm able to target the pinched nerve and only the pinched nerve. This is very different, and it's important to understand why that's different. From a traditional back surgery, a long midline incision is made, and through this incision, a lot of tissue has to be manipulated and moved off of the spine in order to get to the pinched nerve. So a lot of bone, normal bone, good bone, is removed in order to access the pinched nerve. And so, as you might imagine, this results in weakening the back. So people that have had back surgery the traditional way through an open surgery, oftentimes they may still be struggling with back pain, or they may require more back surgery as the bone spurs can come back. And you see, this is because a weak joint is made weaker through the bigger open surgery.
And I'm thinking, doctor, with the minimally invasive surgery, after surgery there's less pain and maybe a shorter recovery time. How are patients feeling after surgery?
Fantastic. It's a dramatic difference, and I think it'll be very obvious once patients encounter other patients that have had surgery this way. And you can imagine with the less tissue being manipulated, there's less pain. So that results in a faster, safer surgery as well.
Sure. So what steps should prospective patients take to learn if they are a candidate for invasive surgery, minimally invasive surgery?
Well, it's important to note that as a neurosurgeon, I address, patients' pain concerns, and most patients don't require surgery at all. So, patients are scared. They're scared of surgery. They're scared to seek medical attention. And problems become worse. The problem snowballs. And so I want to encourage patients who are in pain to get help, early on. And oftentimes I'm able to get an MRI and look and see. And once we are able to diagnose precisely what's causing the pain, we can tailor an individual treatment program to help patients restore their own health. And then if they can't, and if they're stuck, then I can talk about surgical options and whether minimally invasive surgery would be an option for them. And just getting an appointment where I can obtain an MRI and make a diagnosis and then discuss treatment.
Sure, doctor, I'm sure so many people out there right now have questions. Where can they get more information about this?
So our website will have a lot of useful information, but still, there's nothing quite the same as making an appointment where I can teach and show patients, what's going on in their body, and hopefully with that information, it'll be a little less scary for them to see what's going on.
Doctor, thank you for taking time out of your busy schedule to come and do this virtual interview with us. We appreciate it. All the great information. Thank you so much.
Love to help. Thanks.
You're welcome. And you can find out more information by going to the hot link section of WNEM.com.